So
Yeah.
there are a lot of questions as to what's normal is, should I be if you have issues or symptoms, should I be feeling this? Is that normal? Hi guys, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm co-host Dr. Smita down in New Jersey, and I've got Ashley here with me, Dr. Amalfi up in Rochester, New York, and we are continuing our series on labiaplasty, and today we're going to be talking about what is normal. So this is like a very big question, I think. Don't you agree, Ashley?
Yes.
Yes.
Yeah, I mean, moms of girls want to know. When girls are going through puberty, they want to know. And, after they have kids, like, what is this supposed to look like? It's not something we see a lot of, right? Like, you see your friends changing, and I would say, like, as a girl growing up, you really don't, unless you're a doctor, you're not seeing a lot of that, and so it's hard to know what things are supposed to look like, and you're always like, as a woman, like, oh, am I different? Is it supposed to be like this?
Right.
And so I think that's why this is like such an important question.
Yeah, I mean, and I think that's the biggest thing. It's not like you're sitting there and comparing yourself to other people, right? I mean, that is such a private, sensitive area, so you just don't know. There are a lot of questions as to what's normal is, should I be if you have issues or symptoms, should I be feeling this? Is that normal? And the answer is, which I think should reassure everybody, is all of the anatomy down there, no matter what yours looks like, is normal. Right? I mean, I think that's the answer. It's all normal.
There's so much variation. I mean, it could be, it can all be like so different in shape and size and symmetry and length and color, like, right? I mean, it's like,
Yeah, and it can be different, like, even within yourself, right? Like, we have two sides to everything, and each side can be different, and so that also is very normal. You had a good analogy about the columns in our last episode.
Yeah.
So do you want to just quickly mention that again?
Yeah, I mean, I think a lot of people come in and they want to look, almost like a Barbie doll, right? Where you stand up, and those labia majora that we talked about in our anatomy episode, they kind of just come together and everything closes up, and that's all you see is like one little crease where the labia majora come together. But everyone's anatomy is not like that. Some people's anatomy, the labia majora don't come together, and they never will, because the inner tissue, the clitoral hood, and the labia minora almost make their own column. So I always kind of point that out to patients. There's sort of like the 2-column vulva and then the 3-column vulva, and when you kind of stand up and look at yourself in the mirror, that's not really something that we can change. Because that's just the way the tissue originates. But, the length of things, that is something we can change. But either of those is totally normal. And I guess we see a lot of more that closed look. And so we're sort of think that that's the only option for normal. But it is absolutely not. All out external, genitalia do not look like that. So if yours doesn't look like that, totally fine, totally normal. That's just you, and lots of women look just like that, and we see that all the time. So absolutely normal.
Yeah, we see that all of the time, and even whether they do close or they don't. I mean, even there's variation amongst that too, right? I mean, sometimes the labia majora can be fattier or fuller than other people, or other, and some can be thinner with less fat and more loose skin. There's just so much variation even amongst the main categories that I just think that in general you should just rest assured that whatever you're seeing is normal. Whatever concerns you might have, those are shared concerns, most likely from other people. Obviously, this is a very common procedure that we both do in our practices. So and obviously if there's also any questions about what's normal, what's not normal, if you have concerns that are valid or not, I mean, that's why we're here, set up an appointment with your closest board certified plastic surgeon and talk about that. because we've had those
We're here for it.
conversations, right? We're here for it.
Yeah.
I love that.
We're here for it.
Yes.
Yeah. We'll tell you what we can do and what we can't do, and most importantly, what can be done safely.
Yes, exactly. But I think this was, I'm glad that we did this, because I think this is sort of the biggest question, right? And I think the hesitancy, and even, that something bothers you, but you're just not sure about talking about it, and you don't know if you should be worried about it. There's like all of this hesitancy. But whatever you are experiencing is completely normal. It's just a matter of whether you want to do something to address the appearance, or you have irritation, or what have you. So, come in and see us. Ask your questions. Hopefully this series will answer a lot of them that you have, and then you can further kind of dive into things when you come and see us in the office.
I think we just want you to be empowered. Like, nothing is wrong with you. You're totally perfect and normal, but if something is bothering you, and we'll talk about symptoms later, then give us a call. We can talk to you. We can talk to you about what's possible with labiaplasty. So stay tuned. We have so much more to come on this series. Labiaplasty heading your way. All right, see you guys. Bye, Smita.
Bye, guys. See you next week.